Bom dia, meninas. Tudo bem com vocês? Estou esperando aqui o Dr. Shantanu entrar. Ele é um médico indiano, um Vaidya, e ele tem bastante experiência com pele, montou uma aula sobre pele pra gente. Então, faz tempo que eu gostaria de trazer essa experiência internacional para vocês, né? Um convidado internacional e da Índia, para vocês ouvirem um pouco os conceitos deles diretamente, beber na fonte, porque nada como a gente beber na fonte. Então, eu espero que vocês gostem muito dessa aula. E eu vou editar esse vídeo, vou pedir para traduzir, para colocar legenda, né? Na verdade, não traduzir, mas colocar legenda. E em breve eu quero que todas vocês aí da comunidade assistam e tenham essa experiência diretamente da Índia. Então, vamos aguardar ele aqui entrando. Cadê o doutor Shantano, gente? Ele tá aqui falando comigo e não entra. Será que ele tá sem Zoom? Hello, doctor. Can you open your video?
Hello, Fabia.
Hello, how are you?
Hello, Fabia.
Are you
I'm all
me?
good, all good. How are you?
Good? Better
Sorry.
now that we are going to start this class. Are you hearing me?
So, yes, I can hear you. I can hear you.
Okay. Um, just give me a moment, please. I'm gonna just
Okay, okay.
okay, just a second. Okay, doctor. So it's a pleasure to have you here. Well, let's introduce myself personally. I'm Fabia Tavernaro, and I'm a pharmacist about 30 years, and I have a specialization in aesthetic and as Ayurveda practitioner. So I'm studying Ayurveda around 8 to 9 years now, and I made my formation, my graduation in as a practitioner here in Brazil, but I made many courses in India and Nepal and Panchakarma and etc. I've been to AVP last year in the final of the year, in the end of the year, and I studied deeply Dravyaguna. And I'm the first Ayurvedic therapist here that is specialized in skin issues in Ayurvedic dermatology. So I'm we talk about having today a class about skin issues. And I really wanted to give the students this Indian experience from Ayurveda. So welcome to our community. They are going to watch it later because I'm going to put a subtitle first because most of them don't speak English. So I want you to introduce yourself and give the class. I'm going to make some appointments, and in the end, I ask you something, right?
Yes, yes.
So now
So thank you so much, Fabia.
a student. I'm going to hear you and learn from you.
So thank you, Fabia, for having me, inviting me for this webinar, and definitely we'll have some good things from the field of Ayurveda. I will introduce some terminologies of skin issues and Ayurveda with this webinar. So
Yeah.
just a minute. Let me share the screen.
Yes, yes.
So you will translate. You will translate.
Sorry? If I translated.
Uh,
No, I haven't, but you can use this one for your class, for the
no,
class.
no. I'm asking that uh, while explaining the things, you will translate in your Spanish.
Hmm. I didn't, I misunderstood you.
I'm saying that you will translate this session in Spanish
In
for the
Portuguese.
Brazilian audience. On
Yes,
Portuguese, sorry, in the Portuguese. In the Portuguese, you will translate this.
yes, yes.
Okay. So myself, Dr. Shantanu Kumar Mishra. I'm an Ayurvedic doctor and a medical astrologer from India. I'm practicing Ayurveda science as well as Jyotish. This is my eighth generation in the field of Jyotish and Ayurveda. And I'm also into the research work of Ayurveda and the Jyotish. And this is what my subject is all about. Since past couple of years, I am giving online consultation related with Ayurveda and the Jyotish, the medical astrology part, and the webinars and programs and consultations and classes related with Ayurveda and the Jyotish.
Doctor, the next class you gave to us is about Jyotish. Meninas, para vocês que não sabem ainda, Jyotish é a astrologia ayurvédica e eles usam como ferramenta na medicina. Então, já estou convidando ele, porque ele é especialista em astrologia ayurvédica também. E aí eu vou convidá-lo para que ele dê uma próxima aula sobre astrologia ayurvédica. I just told them that I invited you to give a next class already to talk about Vedic astrology. I love it.
Can you see my screen?
Not yet. I see you, but I'm not seeing the screen yet.
Just a
The
moment.
presentation. I allowed you to show it, to share it. Okay.
Can you see now?
I think, yeah. Yeah, yeah.
So I think now you can see the screen.
Yeah, yeah.
So we have the webinar. The topic is about the Ayurveda and the common skin issues. So we are going to talk about the solutions, how the root causes of this skin issues. For example, like acne, pigmentation, eczema, psoriasis, dry skin, and more skin issues we're going to discuss through this webinar. Discover the natural and holistic and effective Ayurveda solutions for healthy, radiant skin.
Okay.
So here we're going to talk about the Ayurvedic perspective of skin, the common skin issues, and the Ayurvedic view. The Ayurveda solution, its practices, the diet, lifestyle, and natural remedies that we have to follow in order to have a good skin, and the last, the holistic healing from within. So the speaker, myself, Dr. Shantanu Kumar Mishra, I'm an Ayurvedic doctor and the medical astrologer. So here we're gonna talk about the first slide we have about the introduction part. The number two slides will be about the functions of skin. We will see a bit small thing about the anatomy, Ayurvedic anatomy about the skin. The Twak according to Ayurveda as per Acharya Shushruth. Anatomy of skin, I already mentioned. The Nidana, the causative factors related with the unhealthy skins. The Samprapti or the pathophysiology of various skin disorders we're going to observe through these slides. The skin type and the care based on the doshas that we'll see. And the skin care and the treatment at the last part we'll see. And some skin care tips that we can follow. So the first thing is about the introduction. The skin not only the protects the body but also performs many excretory and the metabolic functions. As we all know that the skin, its main function is to have the excretory function as well as to release the metabolic waste from the body, the toxins. It is also the seat of the complexions, the main which maintains the beauty and the personality. The incidence of the skin disease is on the increasing as latest survey displays that a very large proportion of population suffers from the skin diseases. So if we talk about the Ayurvedic perspective, that nowadays our lifestyle, our food habits is very sedentary, and that is why there is a disbalance of the doshas, it lodged in the skin and giving us lots of skin issues like acne, pigmentations, dermatitis, and so many other diseases. Now we'll talk about the function of skin. So as I already mentioned, skin is the seat of sense organ. The senses of touch, pain, temperature, pressure are felt by it. The skin is the largest organ in the body. It covers and protects the underlying muscles and the organs. We all know about these things. It's very basic that we have read earlier as well. So it acts as an insulation. It plays a major role in synthesis of vitamin D. We all know that is also very much important. The physical toughness of the skin prevents its the easy entry of harmful chemicals and invading organisms such as the bacteria and the viruses into the body. So it's like a rough superficial view about the importance of the and the function of the skins
Can I
that we
ask
all know
you
that.
something?
Now, sorry.
Can I ask you something?
Yes. You can ask meanwhile. You can ask.
Okay, I was trying to give to the to leave to the end, but maybe it's nice to make some questions between. So, when you tell that the sense of of touch, when you say that skin is the seat of sense organ, because we have five sense organs, yeah, and you mean that the skin is the most important of the five ones, or it's the seat of the five ones? Can you explain to me, please?
I mean to that skin is a seat of sense organ. That means we perceive through by touching things. Let's perceive the object, and by the touching, you get the sense. Okay, the nature of the object, nature of the things. So I mean like that.
Okay,
That by touching, by the skin perceptions, you get the sense of temperature, the sense of object, the external agents. So in that contrast, I'm talking about.
okay, perfect. Thank you.
So now that was a very superficial view. Now we're gonna talk about the twak. That means the earlier part it was relation with the modern terminologies, but now here we're gonna talk about the skin in the Ayurvedic context. So if you talk about the skin, we call as the twaka in Ayurveda. So according to the Ayurveda, skin is the mirror to one individual's health. And that is a beautiful line. That is a very beautiful line that, the skin complexion itself indicates the diseases, whether you are healthy, whether you are unhealthy. So that was the one of the type of Prakriti assessment that the physicians do. The twak or the skin is the matruja aware derived from the mother or having the maternal origin. So this is the belief, this is the science, Ayurvedic science. So Acharya Charak has mentioned that it is having the skin complexions or the nature that is the avya, it is derived from the mother. That is the maternal part, or maybe maternal family. So that is we are deriving from the mother or from the maternal family. Then the next point is the Twak or skin gives the clue to one's Ayurvedic constitution. Doshas, this is usually understood by the type of skin one has. So we all know that in the Prakriti assessment, we observe the nature of the body. If you talk about someone's whose skin is rough, that indicates you the body, the Prakriti is Vatic. Vata dosha is much more aggravated. Similarly, someone is having oily skin, that indicates that okay, this person is having the pittic type of nature. Then someone is having a dull skin, that shows kaphic nature. So that is very basic, but you know that the skin complexion, the skin type gives you a clue to the Ayurvedic constitution. That means the Prakriti, whether you are Vatic, Pittic, and Kaphic. Though we have other criteria as well, but this is a very superficial view. Now, the Twak is known as an Upadhatu, that is the secondary tissues product of the Rakta Dhatu, that is the bladder. Hence, it reflects the qualities of Rakta and the Rasa Dhatu. So we all know that we in the body we have seven tissues, body tissues: Rasa, Rakta, Mansa, Meda, Asti, Majja, Shukra. So this Twaka is the Upadhatu, that means derived from the Rakta Dhatu. Now, we all know that Acharya Shushruta has done a significant research in the field of surgery, also known as the father of ancient surgery. He's an ancient surgeon. So he was the person who checked the anatomy, the Ayurvedic anatomy of the skin. So he named Tvaka or skin has the 7 layers. So he differentiated the skin into the 7 layers, starting with the Avabhasini, Lohita, Shweta, Tamra, Vedani, Rohini, and Mamsadra. So he gave the name as per the characteristic feature. For example, the Shweta, that means the whitish. So in the one layer he got whitish something color, so he gave the term Shweta. Similarly with the Lohita, it is having some reddish color, so he gave the term Lohita. Tamra, again it was showing the color of copper. Similarly, a Vedni part of the skin having the much more sensitive sensations. So this is how he concluded the 7 skin layers. So these layers, when get affected by the imbalanced doshas or the vital energetic forces of the body, give rise to different Twaka Rogas. So Twaka Roga means the skin diseases. So as let's suppose say if the doshas has hampered the Lohita, so again the Lohita region will get impacted and we will have the issues related with the Lohita part of the skin. So it's a very deeper part, but now as of now this webinar we are touching the superficial aspect. So in this slide I have tried to explain the terms, uh, the 7 dhatus and their relations with the 7 layers of skin. And we all know that in the modern terminologies, the skin is having the 5 components. For example, like stratum cornicum, stratum lucidum, stratum granosum, stratum spinosum, stratum germinosum, and dermis papillary, then reticular layer. So these are the 5 layers as per the modern terminologies, and these layers are collated with the Sushruta 7 differentiated layer of skin. And here we are comparing the Sapta Dhatu with relation with the skin layers. So we start with the Rasa Dhatu, also known as the plasma or the lymph plasma, is related with the avabhasni layer of skin, and also related with the modern stratum corneum layer of skin. Its function is circulates nutrients, makes skin smooth and soft. Talk about the second part, which is the Rakta Dhatu or the blood part. It is related with Lohita. So Lohita is what? It is reddish. That is why its term has given to Rohita, refers to Rohita. That means reddish appearance. And this layer is related with modern layer known as the stratum lucidum. Its function is oxygenations and maintains color of skin and lips. The number 3 is the Mamsa or the Mamsa Dhatu, which is relation with the muscle. So this layer is related with the Shweta layer of Sushruta, and in modern terminologies, we relate with the stratum granosum layer. Its function is covers the muscle and provides the protection in the movement. Then the fourth Meda or the Meda Dhatu or the depose, it is related with the Tamra and or the stratum spinosum. Its function is the sebaceous secretions. The Asthi or the bone dhatu, the Asti dhatu or the bony part, it is relation with the Vedani layer of Shushruta or the modern terminologies stratum germinosum. Its function is relation with the teeth, gives support and firmness. Then the second last is the Majja Dhatu or the nerves part. It is relation with the Rohini layer or the dermis papillary. Its function is to provide the sensation of touch, heat, cold, pain, and love. The Shukra or the reproductive part, it is relation with the Mamsadhara layer or the reticular layer. It's provide ojas and immunity and stamina. Now, here we all know that this is the modern part, and the skin is made up of layers of the epithelial tissues. So, for example, the simple squamous is also type of the epithelial tissues. Simple cuboidal, simple columnar, transitional, stratified squamous, stratified cuboidal, pseudo-stratified columnar. So all these are in the relations. So if we talk about a skin layer, we have divided into 3 parts: the epidermis, the above part, the middle part is the dermis, and the inside part is the subcutaneous tissue. So the epidermis is the topmost and the thin layer, contains the melanocytes, the melanin, which gives the color to the skin. The dermis is the middle layer of the skin and thicker than the epidermis. The subcutaneous tissue, it is the lowest layer. It regulates the body temperature. So here you can see the structure of skin, the epidermis, and the subcutaneous tissues. So Acharya Shushruta, he has classified the epidermis, dermis, and subcutaneous tissues into the 5 layers or 7 layers that I mentioned, starting with the avabhasni to the mamsdhara. Now, there's a question: what spoils the beauty of the skin? That means the nidana, the causative factors. What are those? So, the healthy internal radiance is the true definition of the beauty according to the Ayurveda. The several internal and external causes spoil the beauty of skin. So nowadays, in this era, what people think, they think that uh, the skin issues are because of some external causative factors. So for that reason, they are applying some cosmetic products, some lotions, some creams, and still is not working. So in Ayurvedic contrast, we are having the internal as well as the external causes, which spoils the beauty of skin. So if it starts with the aharja, that means the diet. So your diet is very much important, very much important. For example, someone who is consuming the junk nowadays, the spicy, the oily foods, also one of the causative factors of skin issues. For example, addictions. Someone having the addictions like alcohol, using of alcohol too much, tobacco, drugs, viharja, that means our lifestyle. Someone lack of exercise, someone is not doing the exercises, so again there will not be appearance of the sweat. That means the toxins will not excrete out from the body and leads to the dull looking of skin. So that is why it is very important to do much more exercises in order to release the toxins from the body. The suntan, nowadays people are not using the caps, and there is much more intensity of high intensity of sun rays causing the tan. The seasonal changes, in the winter seasons, the skin becomes dry. In some seasons, skin is there, oily skin. Somebody is having the property of having the oily skins. The air pollution again is very much important nowadays. The air pollutants like dust, smoke, dirt can clog the pores, causing the acne and pimples. So this is the external factors which affects the health of skin. Now, the internal factors like mansika. So mansika, that means the mental stress. So mental stress causes the dark circles, loss of complexion, and appearance of the permanent lines on the facial skin. So someone is having too much of stress is also causes issues to the skin. Emotional, someone is having much more anger, which leads to the aggravation of Pitta dosha mora. So again, we'll have some reddish spots in the overtime. Individuals who are in Pittic type of body, they will have boils. There's also some mansic factors or the mental factors. The physical things like exercising too much, working too much, or straining the body over a period of time causes the dryness, rough, and aged skin. So again, this shows that someone who is doing too much of exercising will leads to accumulation of more vata. And we all know the property of vata, it causes the dryness, roughness, and aged skin. This is also very much important. You should have a control over exercises. It should not be that too much. Like other factors like lifestyle. So, for example, sleep, lack of sleep, again, that causes the dark circle, diminish the glow of skin, because if you're not having the proper sleep, what will happen? The vata will aggravate in the body. And once the vata will aggravate in the body, it will cause? It will make your skin dry, rough. So someone is having a lack of sleep, you can easily observe the skin of the individual. Now, here we're going to talk about the Samprapti, the Ayurvedic Samprapti or the pathophysiology. The Samprapti means the pathophysiology. So, for example, here we will start with the Nidana. So, Nidana means the causative factors that I have mentioned in the earlier slides, like lack of sleep, or maybe you are having too much of unwholesome food, unwholesome activities. This Nidana will cause the food enters in the amashe. So now the food which will not be digested properly, if you are having those causative factors like not having the proper food, not having proper sleep, not having proper lifestyle, so that full food will not able to digest properly, because your body will have the digestive strength of the body will becomes diminished. and which will lead to the formation of apakva anna rasa. That means the indigested food. And this indigested food or the armor, which is also known as the armor, which will fails to nourish the dhatus. That means the body tissues. So if we have taken the food, the unwholesome food, and that unwholesome food will not be able to digest properly because our digestive strength is weak. So this undigested food, also known as the armor, will not be able to nourish the body tissues, and this will lower the body resistance, and due to indigestion the toxin gets accumulated all over the body, all over the skin, and naturally these accumulated toxins afflicts the health of the skins. So this is in general pathophysiology relations with the skin issues. So I already mentioned about types of skin like Vatik, Pittik. I gave you some examples, a very single example that I mentioned. So here we will observe some things that the Ayurvedic skin type and the general characteristic features. So for example, we all know that we have three types of skin: Vatik, Pittik, and the Kapha. If we talk about the Vatik skin, so the Vatik skin like someone having the dry, thin, delicate, and the skin having position like cool to touch. Cells get dehydrated, vulnerable to dry, windy weather, age faster, tends to dry, rough, and flaky. So these are the characteristic feature of the Vatic type of skins. Similarly, with the Pittic skin, uh, fair, sensitive, soft, warm, of medium thickness, less tolerance to heat. So these individuals can't tolerate heat much more prone to freckles, moles, when out of balance, can flare up to the rashes, acne, or sunspots. So these individuals, Pittic type of body, they are prone to have these type of things. Now, if we talk about the skin, Kaphic skin. So Kaphic skin, oily, thick, pale, soft, cool, more tolerant to sun. Kapha skin tends to age slower and form the less wrinkles. Struggle with the dull complexion, enlarged pores, and excessive oil, blackheads, pimples, moist type of eczema, and water retentions. So these are the factors relation with the kapha. If we talk about Tridosha skin, someone having all the three factors in the skin. So Vati Pittik, that is the dry and sensitive. Kaphic Pittik. So Tridosha skin means now we are comparing because we know that someone will not have the proper Vatic, Pittik, and Kaphic. They may have Vata, Pitta. They may have Kapha, Pitta. They have Vata, Kapha. Means two dose skin type having two features, like having Vatic feature as well as Pittik feature, Kaphic feature as well as Pittik feature, the Vatic feature as well as the Kaphic feature. So, for example, we talk about the Vata Pitta. So again, Vata will be dry and Pitta factor will be sensitive. So these individuals will have the dry as well as the sensitive skin. Kapha Pitta means uh, as far as Pitta is concerned, the skin will be oily and Kapha will be much more sensitive. The Vata Kapha will be, as for Vata, it will be dry skin and Kapha will be oily. So these two types of doshas skin will have two factors. So now we'll talk about the skin care based on the doshas. So if you, so first of all, we'll talk about the how we can care the individual type of skin. For example, first of all, we'll talk about the Vata type of skin care. So if you talk about internally, what the diet we have to follow, like Vatic type of individuals will have to have the diet which should be warm, unctuous foods and flavored the sweet, sour, and salty taste. The main ideology, main principle is you should have the food which is having the property opposite to the vata. So the Vata dosha, it is having the properties like it is Tatta Ruksho Lago Shitakara Suksma Oshula Anila. Means it is the Vata is dry, Vata is thin, Vata is cold. So we have to choose opposite property. For example, Vata is cold, so we'll choose a food warm. Vata is dry, we'll choose the unctuous food. Vata is, if you talk about the flavor, so Vata having the flavor like pungent, the katu rasa, sourness. So these are the feature. So we should have the opposite property. For example, if we are consuming the sweet, sour, salty taste, so this will pacify the Vata because it is the opposite property. So some food items like organic milk, whole grains, green leaf vegetables, drink lots of lukewarm water every day for internalization, eat plenty of sweet, juicy fruits, includes a healthy fat, ghee, and olive oil. So someone having the Vati type of skin, they should follow these principles. So it was internally. And if you talk about external applications, for example, you can go for the warm oil self massages with organic sesame oil is the best, the tila oil or the sesame oil. Going to bed on the time and pranayama practices that is indicated for the Vati type of skin. Now, if you talk about some cleansing activity of Vata type of skincare, for example, cleansing can be made with the rose water and the milk and the exfoliating like rice, almond powder. You can go for the steaming with the plain water with the fresh mint leaves. Talk about the massaging. So the malai or the milk cream, aloe vera gel for skin issues. Now, if we talk about the avocado mask, avocado is a great for the Vata skin because it's creamy, smoothy, and will hydrate your skin in no time. Mash up the avocado until there is no lumps and apply to your face. You can wash it off in the 20 minutes. Your skin will feel soft, smooth, and hydrated. So this is about the avocado mask you can use if you are having the Vata type of skin. Moisturizing almond milk, almond oil. Now, so we have finished the care of Vatic type of skin. Now we'll talk about the Pittic type of skin. So again, the principle will be same. We'll have to use food habits, food opposite to the property of Pitta. So what is Pitta? Pitta is the hot nature. Pitta is oily. So we have to choose Pitta is the pungent. So we have to use opposite property. So for example, if you talk about the Pitta, so the diet internally, we should have the diet food having the taste of sweet, bitter, astringent, opposite property, sweet, juicy fruits, cooked green water. Eat some rose petal in the jam and cool milk every day because this will pacify the pitta aggravated dosha. Cook with the cooling spices such as the fennel and like rice. It is also recommended for the pittic skin. So externally, massages with the coconut oil, olive oil, sandalwood oil protects your skin being exposed to the sun yoga. Uh, you can perform pranayama. You can perform brisk walk, swimming is also indicated.
Can I ask you
Again, the
something?
cleansing.
Can I ask you
Yes,
something?
yes, sure, sure. Yes.
Do you have this receipt of the rose jam, rose petals jam? Do you know how to make
Can
it?
you please? Yes, I can mention about how to make it. It's very easy, and I have started on my Instagram now to make some herbal products, how we can make it. So I'm working on those things. I know people would like it, and I will share how we can prepare some
Can you share with us
herbal
this?
products.
Yeah, can you share with us this receipt from
Yes,
this
yes, definitely,
rose petals
definitely,
jam? They will love it.
definitely,
Thank you.
definitely. I will share not only about the rose, but I will share all the other things. And Whoever likes, as per, because you have to check the prakriti as well, the type of the skin, and then you can apply.
Thank
Is
you.
not indicated to all individuals.
Thank
If
you.
you are pittic, you can indicate it. So now we talk about the cleansing. The rose water exfoliation is like milk and the sugar candy is indicated. Steaming, you can go with the neem leaves. Massaging with a sandalwood, coconut, or maybe coconut oil. Mask you can use with the crushed rose petal, milk, and sandalwood powder. It's very indicated. Certain herbs that are good for the pitta skin here, for example, bringraj, aloe vera, amla, gooseberry, the red sandalwood, and white sandalwood. This helps in drawing out the excessive heat from the skin and provide the nourishment to the tissue of the skin with withstand the changes in the temperature and helps in keeping the skin clear and healthy. Now, the we can also use the triphala, neem, manjista. These are the herbs. Now we are talking about some herbs. So triphala, neem, and manjista are helpful for the pitta skin as they purify the skin while retaining the moisture and youthfulness of the skin. Ayurvedic formulations for pitta type skin types includes combining these herbs with soothing oils and balance the pitta dosha. So we have so many thousands of combinations for the pittic type of skin disorders in Ayurveda, and Triphala, neem, and manjista are indicated and are been mentioned in the contents. So particular herbs called as the flame of forest helps in protecting the pittic skin type from the harmful effects of sun rays. Should be also used in combination with other drugs. So this we use in the, let's say, with the sunburn or maybe the suntan to remove the tan. We are using internal administration, not only the external, but we are also using the internally. So this is the beauty of Ayurveda. We are not only focused on the external factors now. We are using the herbs internal administrations because this Ayurveda believes your gut is important and your body type is important. That is the prakriti, which is very, very much important. For example, someone who likes the rose water, maybe the rose mask and made from the things will not be indicated for the Vata type of body. So if they are using, they will not get the benefits. It is purely indicated for the Pittic skin. So that is the beauty of Ayurveda. You have to assess the type of the skin. So Pittic type of skin care. For example, this is an example. So I have a extremely freakly red hot Pitta skin, and I have came up with this school of lime evens out the dry skin spot discoloration and helps in pimples and excessive oil. The rin will be the mild exfoliant. Squeeze the juices of 3 to 4 organic limes. Grate up the rind with a smooth grate and add the juices. Pour your mixture into the ice cube tray, distributing the rind evenly. After the lime is fully frozen, you can rub it on your face and take the extra time under your eyelids if they are puffy. So this is for the this is the management for the pittic skin. If you are having some prickly red hot pit, that means the spots, you can use this lime. Now the third thing is the Kapha type of skin care. So again, the main principle will be you have to use diet habit which is opposite to the quality of the kapha. The diet, internally we talk about the diet, the warmer, lighter, less oily and the free of heavy, hard to digest food, bitter, astringent and the pungent taste are indicated. Eat plenty of organic fruits and vegetables. Cook with the warming spices, ginger and the black pepper. Externally, if we talk about the, it's a warm oil massage and regular physical exercises will improve the blood circulation to the skin. Also, using a mud mask at least once a week and scrubbing the skin with a gentle clay for the exfoliation and helps in the internal cleansing of the skin. So for the cleansing, what we can use for this cleansing, uh, the citrus such as the lemon and oranges. Exfoliation, we can use the sea salt and the honey. Steaming, we can go for the mint leaves. Massaging, aloe vera, turmeric, we can use. Face mask is like multani mitti, it's a rock. and the honey and the rose water we can pour into it. Certain herbs like manjista, again, is very good Indian matter. The neem, tulsi, osmium, triphala, turmeric helps in balancing the kapha dosha in the skin. Apart from nourishing the skin, they also help in the detoxification. They also add up the tag skin like brightness and clarity and balances the oiliness of the. So this is for the kapha. So again, for the kaphic type, the ripe bananas, almonds is very good. Is very good. Here we have you can make some maybe some smoothie and you can use it. This is the method that you can use if you are having the kaphic type of body, and this will also helps in releasing the toxin, that is the ama from the body. So again, for the this is also another method. You can also use the carrots, and you can make maybe again a smoothie like that by using the carrot is also very indicated for the kaphic type of things. This also works very well if you are having the maybe skin issues pertaining with two or more doshas. For example, here, if there is a combination of skin type, you can use the carrot, honey, and madhu, that is the honey. So according to the ancient text, it is a scraping dry and estrogen, all great for scrubbing the skin. You can use the sugar if you have got the pitta skin, and you have got a vata or a kapha skin. Use salt. In the bowl of mix the sugar and the honey together and set aside. Blend your two carrot and pulp using the food processor. Mix the carrot with the honey and sugar. Apply to your face. Wait for a few minutes and wash off. So here, if there's a combination, we can use it. For example, if there is more vata, we can add some sugar, and the pitta, we can add the sugar. For the kapha, you can use the sea salt. So this is also maybe a rough practice that individuals in India do if they are having the combination of skin type. Again, we can use the aloe vera having has the ability to provide the essential nutrients, kill bacteria, viruses, fungi. Is very good. You can use aloe vera. Honey, it is also pitta shamik, so you can use the honey as well. So now we will talk about the skin care according to the season. So when the climate is hot and humid, the skin feels sticky due to the heat. Microbial activity increases on the wet skin. Bath daily to keep the skin clean and lower the microbial activity. Use a mixture of soap, nut powder, besan, gram flour, and sandalwood powder to scrub the skin. So this is a very natural method which can be used nowadays to clean the body. Drink plenty of water to compensate the loss of fluid. So this is the management in the summer season that you can use. When the climate is cold, now we are talking about the cold climate and dry, the moisture level, the skin lowers and skin becomes dry and tends to crack. Smearing fresh aloe vera juice improves the moisture level of skin. Massage your body with the gingerly oil, or known as a til oil, once a week. Always wear a warm cotton clothes and socks. Regular foot massages with the warm gingerly oil or castor oil prevents the fissuring of the heels and foot. Drink plenty of warm water to keep the skin well hydrated to prevent the dryness. Now we'll talk about the treatment of skin diseases. So again, the thing which is very much important is to understand the skin type or the prakriti, whether you are vatic, whether you are pittic, whether you are combination of doshas. So we have to understand, and then we can apply to it. So here we are talking about the Shodhana method, or maybe we are talking about how we can use a treatment. For example, in some cases, we are going for drugs administration. In some cases, which is having very chronic issues, we can go for the Shodhana, which is the Panchkarma procedures or the cleansing activity. So here we have discussed about someone who's having suffering with the pittic disorder. For example, someone who is having much more boils, irritations, reddish spot, things like that, and the person is suffering since past couple of years. We have given the medication, it still is not working. So for that individuals, we will undergo the Virechana or the purgation process. Similarly, someone having a dull skin, maybe having some out bulges or maybe boils. So for that, it is a kaphic nature, so we'll administration the Vamana or the emesis procedure. So here we are talking about the Shodhana procedures. So treatment of skin, the scientific treatment has been classified the Shodhana and the Shamana. So in Ayurveda we have the two methods, the Shodhana and Shamana. So the number one is the Shamana. Shamana means the palliative measures. So palliative measures like we are removing the causative factors. We are administrating the drugs, administrating the herbs. So this comes under the Shamana. The number two, if the Shamana is not working, we are giving since couple of months, couple of years, it's not working. So now the physician will move to the Shodhana. That means the cleansing activity. That is the Panchkarma. So the Shodhana Chikitsa treatment, when the doshas are vitiated in a large quantity and disease is the chronic, then the Shodhana Chikitsa should be applied first. Acharya have classified Shodhana as the like Basti, Vamana, Rakta Mokshana, bloodletting, and the Nasya. Shamana Chikitsa, again, I already mentioned. The Shamana treatment is administration of proper food, medicines by mouth is the internal treatment, application of medicated lap, oil, external treatment. So this all comes under the your Shamana. Ayurveda has said that for all skin diseases, Khadira is the best as an oral medicine and the Aragvat is the best for the local application. So the two herbs, if you don't know the treatment, nothing. So what you can go, you can use the Khadira. You can use the Khadira as oral medicine and Aragvat. So medicine made up of Aragvat you can apply. So it's very, very much indicated. Shishira, Lamajkaha, Nagakesara, and Lodra are used for the hyperhidrosis and the anti-sweating agents. So this is also an herbs used as a shamana. Treatment of skin disease, shamana chikitsa. So we have several herbs combination here. So we have the 10 drugs, which is known as the Varniya Dravs. So these 10 herbs are herbs which promotes the complexions. For example, by if you know the trend, these herbs, you can make a product by naming the that by claiming that this herbs will or this product will promote your complexion. So as per Acharya Charak, these 10 drugs known as the Varniya Dravyas. Now another very very good preparation known as the Shata Dhota Grita. It is very very indicated formulation. Shata Dhota Grita. Here the Shata means 100 times. Dhota means the washed, and Grita is the oil that you abstract from the butter. So the traditionally Ayurvedic skin creams. So what we'll do, we will just add the Grita and we will wash it by moving clockwise by using a utensil, moving it clockwise 100 times and adding the water. So slowly, slowly, it will turns into the cream. It is a completely natural and the chemical free, very useful for achieving the radiant and glowing skin. Shata Dhota Ghee is prepared by organic ghee made up from the cow's milk by washing it repeatedly 100 times using a specific method prescribed in the uh, Samhitas. It is excellent estrogen moisturizer, anti-wrinkle cleansing cream can be used as a daily moisturizer of the face for the facial massage, also has a calming effect on the radiation, burned skin, and on the eczema and the rosacea. So this is the product that anyone can make it at their house, at their home. They can make it. It is very easy. You just need the cow's milk oil, and you have to just you can watch my YouTube channel, and I can share it, and you can prepare the Shatagrut this cream, and you can apply daily. Maybe to you, to your babies, to anyone. You can. This is indicated in every case.
It will
Then
it would be very nice if you shared this, how to make it, how to wash it.
definitely, I will share because without video, it will be impossible for someone how to make it. So definitely, I will share the video of
Yeah,
making. Now
thank
we'll talk about the another some formulations. So it is, I will ask everyone not to use directly. It is better that you should have a consultation with an Ayurvedic doctor, physician, because they have some ingredients which are not indicated. First of all, you have to check the body type. Let's first say I watched the video of Lodradi Lepa and I started applying and I'm not getting the result, even though I'm getting some complexion, some other issues because of that. So we have to check indication, contraindication, and first of all, consultation is a must. So, for example, the first is Lodradi Lepa, is a paste prepared with the mixture of quality of Ayurvedic herbs, Varnya Drabs that I already mentioned. So, it is indicated in the acne vulgaris, blackheads, pimple skin, and blemishes. Similarly, sandalwood, sandal herbal facial pack that is also that you can make. Now, so this is the method that you can use in order to clean your skin to keep it healthy. For example, drink 7 to 9 glasses of lukewarm water, avoid junk foods, 8 hours sleep. So this is indicated to everyone. Doing pranayama, yoga, 15 minutes, and these all managements that keeps the skin healthy. And again, there are some herbs and some the that you can use. For example, cucumber, carrot, watermelon, pomegranate, grape, sandalwood, uh, turmeric can be used according to the skin type and season. So you can use as a paste. So here is some skincare tips. The aloe vera that you can use, known as the Kumari, is indicated. Then again, these are these are all are mixed, but the we have to keep it very basic. What you have to use, you have to check first of all your skin type. It is Vatic, Pittic, and Kaphic. And accordingly, I already gave you indications what you have to do, what you have to skip. So it's better to focus on those things. So now we came to end. So we have seen about skin, about the functions of skin, Twak, that is the Sanskrit word for skin, and we have seen the modern terminology related to skin. We have observed skin care based on the doshas, Vatik, Pitta, and the Kapha, and Vatik, Pittik, Pittik, Kaphic, and Kaphic, Vatik type of skin. We have seen the management skincare product based on seasons, skin diseases treatment in Ayurveda, and some skincare tips related with the specific doshas. So I think this is what I have tried, and maybe now I think you can ask some questions if you have any doubt.
Thank you for the class. It was so complete. I only would like to ask you because they have this problem here in Brazil because of the sun exposure and everything else, but they always want to know more about melasma. Uh, it's one of my the problem that I most treat every day with my patients, and the treatment it's very successful in the most of time. But I would like you to give us some tips because, of course, melasma is an inflammatory disease, so it's never only about melasma. When I treat melasma, I have to treat it always thyroid or gut, stomach, etc. Stress, emotional things, and but it's very grateful because the results are very good. But I would like you to give them some tips for this.
Okay. So, as you have mentioned about the melasma, also known as a chronic hyperpigmentation, usually people are having. So in Ayurveda collations, we give a term known as the Vyanga for this melasma. And it is purely related with the Pitta dosha and the vitiation of the Rakta Dhatu by Pitta dosha, which is causing these issues. And the common triggers, it is due to the hormonal changes, stress, pregnancy also, someone who is reported by the oral contraceptives also, and thyroid issues that you've already mentioned, the cosmetic and you by using the steroid creams also that can be happened. So if you talk about, we have to keep it very simple that this is due to the Pitta dosha, first thing. Then you have to check the prakriti of the individual. What prakriti the individual is having. Whether it's Vatic, Pittic, Kaphic. Then you have to check the gut habit. And then you can apply the treatment, type of treatment. Because in Ayurveda, the treatment is individual specific. You can't, let's say, I can't give you maybe a fixed treatment, a fixed prescription for everyone. There you have to use your UK. You have to use your own brain. You have to use the skill that you have developed, the theory that you have read, the samitas, and then you can focus. So this is a very we have to treat is the first thing the pitta, adhisthana, then the body type of individual. So
Uh,
this will help you. This will definitely will help you to because I can also mention the herbal combination, maybe the drugs, Ayurvedic drugs. Okay, for the melasma, you can use this, that. Okay, but I have to keep it very simple for everyone. That is not necessarily important to remember thousands of Ayurvedic combination. What is important is to know the Prakriti assessment. This is very much important, and the Nidana, the causative factors.
yeah, that's what I always tell them because, of course, melasma has pitta involved, but it depends why this pitta is imbalanced. Probably sometimes because the Vata is imbalanced and then made the Pitta imbalanced, or Kapha is imbalanced and then made the Pitta come imbalanced. So it's really individual. You were right, and I want them to hear from you because I always tell this. Of course, we can give some tips, but the treatment it's really really individual because the nidana the cause are very different from the food they have, from the stress they have, from well their histories of
And
life.
the Desha as well, the Desha.
Yeah. So thank you so much, Dr. Shantanu.
Thank you so much.
And we are going to organize the next class for Jyotish, okay? Because they are going
Definitely, definitely.
crazy about Vedic astrology. So I made my first map, Vedic map in 2019, and it was very important for me to decide to be a Ayurvedic practitioner. So thank you very much, Dr. Shantanu. We talk later in the WhatsApp, okay?
Thank you. Okay.
Bye bye.
Namaste. Bye bye.